So good afternoon, Mayor Pro Tem and council members. We actually have a fairly short update today. There's not a lot to update you on. So I'll do a brief presentation, and then I wanted to ensure we had time for any questions and questions you may have that we can answer. And one thing I'd like to start off by saying is we're going to start going to having these updates every other week before our council meetings. And that's just because we're finding we're not having as much information to provide on a weekly basis. And I believe you all received the update from our city manager's office. So Sarah, if we could go to the next slide. One thing I wanted to bring your attention to is we're going to start presenting this information over a 2-week period versus a 1-week period, since we're doing these updates every other week. So we're starting it this week, and over that 14-day period, we've had 47 additional cases, 0 hospitalizations, and unfortunately, 1 additional death. And our positivity went up slightly, very minor. Again, our metric that we're looking at across the metro region while we're in level clear continues to look really well or good in Broomfield. You can see our hospitalization 14-day moving rate is at 0% right now. Next slide. As far as at the state level, we're still seeing 11 to 17-year-olds that account for the majority of our cases. Hospitalizations have been trending down statewide, and our testing was lower over the Memorial Day weekend, but it's starting to increase. The other thing we're starting to see statewide is some disparities between counties. So again, those counties with lower vaccination rates, we're seeing some increased cases, and specifically there was an article on Mesa County where they have the P1 variant, the Indian variant out there that's spreading, and due to both low vaccination rates and the variants, they're seeing a high level of cases out there. So we'll hope that we continue to see vaccines not only increase here in Broomfield and the metro region, but statewide. As far as for Broomfield, we're in a really good place still. We are seeing a slight elevated incidence from 22.5 cases on May 25th to 33.9 per 100,000. We want to see if this continues as a trend before we start to make any conclusions based on it. Our current percent positivity is 2.4%, so again, extremely low. And our 20 to 29-year-olds had the highest case incidence in May. Not really much to update on our variants. You can see that the UK continues to be the predominant strain here in Broomfield and across the state. And then great news as far as hospitalizations in the North Central region. What we're seeing is hospitalizations are decreasing, and they decreased from 248 to 214 patients over the last week in our ICU bed. Availability remains in green, which is a really good measure. So overall doing well, both statewide and locally with trends. Next slide. As far as Broomfield and vaccinations, we've exceeded our goal before July 4th of having 75% of our population that's received at least one of the vaccines, one dose of vaccines. So yes, way to go, Broomfield. Our community really stepped up, and what you can see is we're starting to see a leveling off. Sarah, if you go back to the last slide, of those that have completed vaccines, but we're still seeing that increase in those that have initiated vaccines. So again, that's our 12 to 15-year-old population where we're seeing that. And what we're going to see over the next few weeks is community partners will be hosting vaccine events. And our role in public health will be mainly to provide support to those partners And we will still have our targeted efforts to reach those who are not yet vaccinated throughout the summer. And what we've been doing is working very closely with local businesses, schools, and the nonprofits to try and reach those demographics I'll get into later as far as the age groups we want to see our vaccination rates go up. Next slide. And this just shows you where we're at as far as our cumulative vaccination rate to our 7-day case rate among Broomfield residents that are 12 to 29-year-olds. And what you can see over this is as our vaccination rate goes up, our case rates have been going down dramatically. And currently we're at 60%. We would like to ultimately get to 70% vaccination, both in our 12 to 15-year-olds, 16 to 19-year-olds, and that 20 to 29-year-old age group. Next slide. And this just further illustrates where we're at as far as by age group, those that have been vaccinated. And as I mentioned, our 20 to 29-year-olds are the ones that are where we're seeing the greatest majority of our cases. And you can see that that's the area they've been eligible for the vaccine for a long period of time, where we need to continue to do our targeted outreach efforts to hopefully increase that number. And we're seeing our 12 to 15-year-old age group going up. We're almost at 50% now. Hopefully for both the 12 to 15-year-olds and the 16 to 19-year-olds, we get them up around that 70% vaccination status before the school starts in the fall. And the reason for that is then hopefully we can further loosen mitigation efforts within the school setting for those age groups that are vaccinated. And you can see that we have targeted communications that are going out specifically to parents and young adults, encouraging them to get the vaccine. The next slide. And this just again shows where we're at as far as our seven-day cumulative case incidence. And what you can see is that we had that dramatic drop as we started to see our vaccination rate increase. The one thing we are seeing is again that slight trending up of our 7-day incidence rates. We'll have to see if that was a blip that was due to the Memorial Day holiday, or if it's something that continues to trend up among those that are unvaccinated. Next slide. So to summarize, we continue to remain in level clear. We'll be there through August 16th. Again, with us lifting capacity restrictions, we're not seeing a significant increase in cases, which is what the model was showing would happen. And as far as the statewide public health order, that was amended. It's no longer the governor's order, but now it's the Colorado Department of Public Health and Environment's order, and it's for specifically face coverings. What they did is they aligned it with those who are eligible for the vaccine. So 12 and older individuals who are not fully vaccinated still need to wear face coverings in limited settings, such as schools, childcare, camps, motor vehicle offices, prisons, and healthcare settings. And again, those individuals that have not been vaccinated yet also have to, it's recommended that they wear face coverings in these settings and other settings as well. And I believe that's our last slide. So with that, that concludes my presentation, and I'll first ask Deb and Sarah if they have anything to add, and if not, I'll turn it over to council for questions. Deb or Sarah? Looks like we don't, so we could go to council. Councilmember Hinkle.
Thank you, Jason. It's kind of nice not to have to talk about new orders and, you know, new 5-star program and those things like that. So it's very heartening to hear that we're kind of on the tail end of this, you know, just keeping an eye on the variants. I don't know if you actually know this answer or not. And if you don't know, I would totally understand because it deals with schools. But do we have any indication as to what the schools are actually planning? I know that some schools have already told people that they're going to go back without, you know, masks in certain areas, not necessarily Broomfield. But do we have any indication from the school systems as to what their possible plans are or when they're going to make their decisions?
Yeah, so it's a great question, Councilmember Hinkle. And currently the public health order includes schools. So the schools have to follow the current public health order. We'll have to see if that extends into the fall. The other thing is the Colorado Department of Public Health and Environment has their school guidance specifically for quarantines and school outbreaks and school closures if needed. And that was updated slightly, but it still has a lot of the same provisions that were in it before. There have been discussions at the metro level with the Colorado Department of Public Health and Environment of if we start to reach certain vaccination levels in communities and with those age groups, will we see that school guidance change from CDPHE and the Colorado Department of Education? At this point, we haven't received a response from them yet. I do know there are some districts that are saying this is what our plan is going to be, but the 2 districts we've been partnering with are continuing to follow and look at the CDPHE guidance, and the state order is their guidance for now and haven't made any different plans.
Okay, thank you very much.
You're welcome. Councilmember Lynn.
Yes, I was wondering what your recommendation was as we go back into council chambers. I mean, in previous times, we would have had some interaction with the public, like either before or after or something like that. So what would you suggest? I mean, if we're talking to each other, as council members, I feel fine with not wearing a mask, and because I'm familiar with the situation with everyone. But with the public, we're not familiar with everyone's individual situation. If they have a school, a child under 12 at home, that kind of thing. So what are you suggesting we should do? Should we put on a mask to speak to the public in council chambers?
Yeah, my recommendation is if you're fully vaccinated as a council member, your chances of both contracting or passing along the virus are extremely low. So interacting with fellow council members, yourself, if you're fully vaccinated, a mask really isn't going to make a difference for that individual. Same thing with the public. If you're fully vaccinated as a council member, that individual, it's very unlikely that you would be passing along the virus or transmitting the virus to that individual. Now, if council members are not fully vaccinated, my recommendation would be obviously to wear a mask and wear it around, especially those individuals that are coming in, because you don't know their vaccine status. They may or may not be fully vaccinated.
Okay, thank you.
You're welcome. Councilmember Castriota, or Mayor Pro Tem. I apologize for that.
That's okay. I guess my question is more too about internal going back in person, like our boards and commissions. Do you anticipate like HSAC going back in person this month, or do you know what the plans are for the boards and commissions?
Yeah, and I'm not sure if our city manager's office is on, but I know those conversations are happening right now with boards and commissions and following the same process that our city council has taken. And so There's two things that we're looking at, is my understanding. One is obviously the need to have an in-person meeting. And we all get that there's a lot of benefits of that, of the interaction that you get in a group setting. So that's obviously ideal, but sometimes these meetings are good in a hybrid setting because you can get more participation from people that may not necessarily be able to make every single meeting. So that's one thing we've been looking into too, is how could you have a in-person meeting that's still virtual and have people participate. So more to come from our city manager's office on that.
Yeah, sounds good. I love that because I know that we're going to continue with our public comment remote service so that the residents can call in to participate, and they're not required to come into the chambers if they don't have childcare or, it doesn't work with their dinner schedule, which, is a real thing, or health issues, and they can still participate. So I like that. I like the fact that you can offer people more options to participate.
Great.
Thank you.
You're welcome. Well, I don't see any additional hands, so that concludes my presentation, and I am very excited to be in person tomorrow, see you all, and look forward to having a great council meeting. So again, thanks for all your support and have a great Monday afternoon.
Thank you all so
Bye.
much.
Thanks,
Bye.
Mayor Pro Tem.
Thank you.